I'm your student nurse today. The doctor has ordered to have your tracheostomy suctioned. Do you have any questions about what that is or what that means? Have you had it done before? Okay, awesome. And can you go ahead and tell me your name and date of birth? All right. And do you have any pain right now? Okay, that's good, no pain. Do you have any allergies? No? Okay, great. I'm gonna put this O2 monitor on your finger here so I can monitor your oxygen throughout the entire procedure. Looks like you're running about 98 right now, so that's good. I'm just gonna take a quick listen to your lungs. All right, awesome. Sounds like you can definitely use some suctioning. So we're gonna start this procedure. If any time throughout the procedure you have any type of respiratory distress, you need me to stop, you can just give me a thumbs down so I know, okay? So I'm going to turn your oxygen up so that I get you hyperoxygenated throughout the procedure. And I'm also gonna check my suction, make sure it's not going above 150 because you're an adult. And I'm gonna get you set up in a semi-Fowler's position. So after I've got all that going for me, I'm gonna redo my hand hygiene. And I'm going to go ahead and make sure I've got my PPE on, and these are gonna be my goggles. And I've got my patient has a water resistant pad right here, which is actually just a towel right now, but it'll work. And I'm gonna open my sterile equipment, and I'm going to put on my sterile gloves. All right, now that I'm sterile, I'm going to dispose of this very carefully. I'm going to take my saline, I'm going to lip some of it into the trash, pour it into my sterile container, very carefully set it down, and I'm going to take my suctioning catheter, dispose of this in my trash, and I'm going to wrap this around my dominant hand, leaving about 10 to 15 centimeters out. Okay, after I've done that, I'm going to connect the catheter to the suction. And this is now my dirty hand. So I'm going to remove her oxygen, and I'm going to place the catheter into my sterile water, and I'm going to insert the catheter into the tracheostomy, and on my way back out, I'm going to start the suction. And if they need another pass, I'll just simply do it again. Do you feel better? Awesome. You think you need another one? Okay, great. So I'm going to just put their oxygen back on them. I'm going to dispose of my catheter properly. and I'm going to turn my suction off and turn my O2 back to the prescribed rate. And I'm going to make sure that do you have any pain or discomfort? Okay, you're doing good, that's great. Do you have any questions or anything? Okay, awesome. So I'm going to clean up my mess, and I'm going to document, report, record, come back and reevaluate, and I'm going to do my hand hygiene again on my way out. I'm gonna make sure that I've got the patient back down to a low position, call light and reach, all of that. And I'll come back to do your trach care here in just a minute, okay?